Well, good afternoon, everyone. Hope everyone's enjoying their lunch. We're going to go ahead and move into the next segment of our day here, which is our panel discussion on the Affordable Care Act. So before we get started, a couple of housekeeping notes. First, my name is Brian Volner. For those of you I haven't had the pleasure of meeting yet, I'm a senior vice president with C1 Bank, and it's a privilege to be here today moderating today's panel discussion. I'd like to say a couple thank yous. First, I'd like to thank Manatee Chamber for all their support, as well as our Leadership Alumni Association for putting together today's very informative, educational, and then, of course, timely and relevant discussion. A couple other notes, just so that no one gets mad at me at the end of today's presentation. So full disclosure, we will have time, if I do a decent job, for some Q&A at the end. But please respect the fact that all questions are reserved for alumni, leadership alumni, okay? So if you're not an alumni, I would ask that you please withhold your question, all right? And what we'll do is the format will be as follows. If you have a question, and I'm sure that you do, please introduce yourself, what year you graduated. If you'd like to share what color you were in SimSoc, of course, that's always welcome. We like to get a couple laughs and boos, perhaps, and then we will go from there. I would also ask, as a professional courtesy, that any questions be just that, questions, not political comments. This is in no way, shape, or form today a political discussion, okay? So I see Dan says he's leaving. All right, that's okay, Dan. But it's not about political correctness today. It's about being politically accurate. And so this is why we're steering clear of what side of the fence your views may fall on, and let's stick to informative and educational discussion. Everybody in agreement with that? All right. Very good. So the rules of the game have been set, and I will blow my whistle and play referee if necessary, but it doesn't appear I'll need to do that today. Okay. So just a couple notes on what we're talking about today. I'd like to read those to you, and then we'll get right into the introductions for our panelists, who are going to be our industry experts, providing us with some great answers to many questions that have already been gathered from many of you, as well as others in the community, that we feel are important to be addressed. So on March 23rd, 2010, the Patient Protection and Affordable Care Act, also known as healthcare reform, and most commonly known as Obamacare, was officially signed into law. Since that time, healthcare reform and its impact on businesses and individuals continues to evolve. Healthcare concerns are definitely not new. In fact, healthcare spending has exceeded U.S. economic growth in every recent decade. Rising costs, along with an increasingly complex healthcare system, make it an even more important issue for businesses and individuals alike to have a clear understanding of their healthcare benefits. So to help answer some of these important questions related to the Act, we have put together our panel of business professionals from banking, accounting, and insurance to help us gain a better understanding of how it will affect our business owners, individuals, and families. So please hold your applause until the end of my introductions of our panelists, but our panelists today, who we thank very much for being here, are as follows. We have Kathleen Hargraves sitting in the center, shareholder of Healthcare Tax and Consulting with Kerkering Barbario. We have Chris Pennewill, Tampa Bay Regional Credit Executive with Hancock Bank, seated right here to my left. And then we have at the end Steve Hall, GBA and Certified Affordable Care Act Professional. It's a mouthful, Steve, with All Trust Insurance. So please join me in welcoming our panelists for today's discussion. And now, let's get right into our questions. So the first question I have, and the way we'll do this is I'm going to try to guess who might be the best person to address this particular issue or question, but if you guys want to piggyback and jump in there, feel free to do that. But I'm thinking this one's going to be directed toward Kathy, so congratulations, Kathy, you're first up to bat. And the question that we received is, where are the revenues coming from that will fund the Affordable Care Act or Obamacare?
That's a great question. Can you hear me well? Yeah. I just want to say I was on the blue team for all you blues out there. And I'm not going to give you the year I graduated. It's private information. The revenues are coming from a variety of different sources. And we're probably not going to talk about this much today, but of course, there are revenues coming from the healthcare side. They're going to have decreased reimbursement. They're rearranging the way healthcare is delivered on that side. It's not a topic we're going to address, but there'll be significant savings, let's say, on that side. In addition, of course, taxpayers who make over $200,000 to $250,000 will be paying on increased Medicare taxes. We'll talk about that a little bit later. Employers are going to be paying penalties. There'll be several penalties. Again, we'll be talking about those later on large employers. Individuals will also be subject to penalties. And there are penalties imposed on the insurance companies, or taxes, let's say, and on some other sectors of healthcare. So it's really everyone who's going to be paying for this act.
Okay. Thank you, Kathy. Chris, as a businessman in our community, how do you see Obamacare affecting your clients and other business professionals?
We see, oh, by the way, also, any Reds out there? All right. Oh, okay, not many. We keep a low profile. We're still going through therapy about how it all turned out. We're seeing actually affected in two different ways, both from an expense standpoint and a revenue standpoint. On the expense side, dealing with companies with over 50 employees, primarily a lot of hourly ones that have more hourly employees, restaurants, light manufacturing are having to deal with it, trying to figure out how to navigate it. And then on the revenue side, we deal with a lot of healthcare companies, so doctors' practices, hospitals, managed care companies are trying to figure out how their reimbursement is going to be affected going forward. They might do a lot of Medicaid, Medicare. They're not sure how that's going to wash out. And so, we're both seeing it on both sides, both revenue and the expenses. And so that makes it challenging for us as a bank if they're coming to us, say it's a doctor's practice, come to us looking to refinance their building. We really have to try to look at, okay, how much of their revenue comes from Medicare, Medicaid, how's it going to be affected, and try to understand the ramifications. If we're maybe they're looking to expand, taking on more debt, well that has to come into play in our analysis of whether they can meet that obligation. Of course, they are concerned about it as well. They're not just saying, hey, we need more debt. I mean, they feel like there's going to be some increased revenue opportunity just more by serving more people, but something that we're seeing again on revenue and expenses.
Okay, well, and that segues into the follow-up question that I have, which is, it sounds like it is coming up fairly frequently,
Yep.
but not only coming up from the client's side of the equation, but also from your side as a lender.
Absolutely.
Okay.
We when we go on calls, meeting with both existing customers and prospects, we're assessing whether they have more than 50 employees. What type of plan do they currently offer? Have they done the analysis? Do they have an A&A plan? Whether it's affordable and adequate, and does it meet the definition of under the Affordable Care Act? Have they done the analysis? And I'm sure we'll get into this, but there's some examples of it's cheaper for them to drop their plan, pay the $2,000 to $3,000 per worker fine, and have the worker go out and get insurance because it might cost them $5,000 to provide insurance. So, they're definitely going through that analysis, and we're trying to prompt them that too, because just like anything, a lot of people ignore problems. I don't know if y'all have ever run into that, and they kind of wait until the last minute. And I think, frankly, there's a lot of business owners out there that are hoping this just kind of goes away. And I think reality is starting to set in that it's not going to go away, and so they need to start focusing on it and dealing with people like Kathy and Steve on, okay, this isn't going away. How do we deal with it? So.
Okay, thank you. And Steve, next question is, what parts of the Affordable Care Act are enforced today, and then what parts after 2014?
Thanks, Brian. And again, like Kathy as well as Chris, I was a yellow team. I actually graduated a couple years ago as the 2011-2012 class, and as I'm spanning the group here, I'd say I see at least 5 or 10 folks from our class in here. So we definitely had a good time with that, and I'm glad to have the opportunity to talk to you all about this particular subject. So basically, as many of us know, the Affordable Care Act came into play in 2010, and since that time, there's been quite a bit of changes that have happened as a result. So initially, as of today, you can have a dependent child on your plan, on your employer-sponsored plan, up to the age of 26. No pre-existing exclusions for children up to the age of 19 on the plan. Lifetime dollar limits on essential health benefits are prohibited. There's also medical loss ratio that came into play right around 2011, where basically now the insurers are accountable. We're basically in a small group space, less than 50 employees. They're accountable that a certain amount of the dollar that you pay in premium goes towards the actual plan, and so much of it goes to the administrative cost of the plan. And maybe some of y'all work for an employer who've actually gotten a rebate through that. I know several of the groups that I work with, that's been the case where they've actually had rebates that they've issued out to their employees. So that's been a nice benefit. There was also a form that's used. It's a universal form. It's called Summary of Benefits and Coverages. It's basically a 4-page document, double-sided, a certain size font, and what it's supposed to be is a universal form that all carriers use to help communicate the benefits to the member, so that way you understand your benefits better. And it actually has even some examples on those forms of, my wife's pregnant, how much of the cost associated with the different cares that are associated with having a child. Coming around in 2013, employers must provide a notice to employees regarding the insurance exchanges by October 1st, which is right around the corner. Interesting thing to know on that is that's whether you have benefit plan or not. So if you're an employer and you don't offer benefits at all, and frankly all your employees are part-time, you're still required by the mandate to issue out an exchange notice by October 1st. For those of you that work for a larger employer that provides benefits, or even a smaller employer that provides benefits, you probably have already received, I know we did in our firm, I received just the other day a notice, and it basically lets me know whether the plans that are available through my employer are affordable and or adequate. And if not, how does the marketplace work? Where do I go to access coverage? What happens if I access coverage to the plans that I'm currently having through my employer? And it's a pretty concise piece. It's usually a couple pages long, and it really gives a lot of detail on the marketplace. And then some things that have actually been delayed, let me go on in 2014, apologize. There's some of the fees that are getting embedded in the plan are starting to come in. I know in some of the renewals that we have coming up for January 1, we're starting to see if there's a health insurance provider reinsurance fee. It equates to about $63 per insured member on the plan per year. So that could be quite a bit of an expense for the employer as well as the employee to take on. Health and plans cannot impose waiting limits greater than 90 days. So basically, most of my professional life, I've worked for employers that have offered benefits, and benefits were always eligible after 90 days of employment, like a probationary period. Well, moving forward, the plans cannot exceed 90 days. So we're advising a lot of our groups to offer benefits the first of the month following 60 days. No limits on annual dollar value of essential health benefits. 2014, you can take the word pre-existing condition and kind of just throw it out the window, because in our world in insurance, there's no, you can't be denied coverage like in the individual marketplace. Like for me personally, I have asthma, right? So let's say I'll go out to the individual marketplace and I try to get coverage, and they say, I'm sorry, they decline me, right? Because they want a good, healthy risk pool. Well, moving forward, January 1, 2014, you cannot be declined coverage as a result of a pre-existing condition. So that's another thing that I think is pretty good for the members as well as all the individuals on plans. And then there was some delays. Some of the delays that took place is that right over the beautiful 4th of July highway Fourth of July holiday when I was on vacation with my family. We got notice that the penalties as well as the reporting aspect of pay or play mandate was actually delayed until 2015. So some of the stuff has happened gradual. So I think some of it, you might not even be aware that some of the benefits that you're currently experiencing are a result of healthcare reform, but quite a few changes have taken place. And I'm just highlighting, a handful of them right now. So thank you.
Thank you, Steve. Next question is a tax question. So I'm going to go to our resident tax expert, Kathy. And the question is, Kathy, what are some of the steps individuals can take to save on taxes relative to the ACA?
That's really not a new question. That's a question I get asked about every year from everybody. But seriously, the two impacts are, of course, the additional Medicare tax on wages. So any of you who are lucky enough to have wages of over $200,000 a year have already started paying the tax. That's a Medicare tax, an additional Medicare tax that you hadn't paid before. So that's already in the paycheck, and it's actually on a household. We're looking at on a joint return. So if let's say husband, wife, one of them's making both are making under, jointly they may be over the limit of $250, so you'll have taxes imposed when we actually do your return. The other tax, of course, is on what we call passive income, and that's a tax on interest and dividends and rentals and the things that again, if you're fortunate enough to have that thing on those kinds of additional income, you would pay an additional tax. And again, it's subject to the same limitations. So anyone who's trying to tax plan for savings is going to start using some of the tools we've already had in place. If you happen to have a company and you have the opportunity to put in place employee benefit plans such as a retirement plan, you would want to really consider maybe upping or increasing benefits. Again, any money that you or income that you can defer, meaning you're putting off the payment of taxes until the future, is going to help you today. So you might want to get with your planning professionals and your tax professionals and think about putting money into things like annuities, things like any insurance product that might be tax deferred. Those are non-qualified plans as well as the qualified plans. Anything to sort of get the income off of your return. If you're used to getting, let's say, dividends, there are investments that may not pay dividends but may grow in a different way. So, and then the other thing we do is we look at what's passive in terms of the activities. So that's a little bit more complex, but those are the commonly used things that I think we're planning for. And we've been planning all year.
Okay, thank you. And this one I'll open up to the panel, whoever would like to take it. I know Steve had alluded to a term that I'm unfamiliar with, and I was hoping that one of you would be happy to tackle it, and it's the term exchange. So maybe one of you could share with us what are exchanges as it pertains to the plan.
I'll let you start and I'll pipe in.
So all the way up until, I couldn't tell you a specific date, let's say within the last 6 months to a year, they were called exchanges, right? The states were either going to run an exchange or the federal government was going to come in and run a federally facilitated exchange, and now they're actually called marketplaces. In essence, there's two different types of exchanges that we hear about quite a bit today. One is a public exchange, the other is a private exchange. A public exchange is where us as individuals can go out to this exchange. Depending on our income level, we may or may not qualify for a subsidy through the exchange. The idea behind that is that I go out to the exchange and I basically have access to plans from a variety of carriers. In Florida, it really hasn't been mapped out yet exactly what carriers are 100% participating in the exchanges or not, but let's just say as an example, I might go out there and see United Healthcare, Aetna, Cigna, Humana, and maybe 5 or 10 more, who knows? And then I can actually pick a plan. I think one of the cool things that's going to happen on this particular exchange is the ability, and I did it wrong again this year, right? I was supposed to pick my plan for the year. I didn't know that I was going to hurt my back and have to get some MRIs done and a lot of unforeseen things. So I wish I would have taken the high plan, but I actually took the low plan this year. Well, on the exchange, there's going to be a vehicle, and it'll actually allow you to enter in some data. And as a result of that, it might say, hey, Steve, you should be taking this HMO plan because you have asthma and you have reflux or whatever your costs are. Or maybe an HSA plan would be ideal for you because you don't have a lot of costs. So I think a lot of people would agree to have that kind of support in the individual product where you don't have access to a broker or consultant might be a good deal. On the flip of that, there's going to be private exchanges. So a lot of firms, like probably several in the room, I know at All Trust we're doing it. Basically, we create a private exchange where we can go to an employer group and we can basically create a private exchange that their employees can go to and could potentially purchase individual products on a private basis. There could be multiple carriers that participate in the exchange or maybe just one. As well as the other benefit to that for a lot of employer groups is that to help with the administrative side of facilitating benefits, they might offer this private exchange. An employee can go out to that exchange. If, let's say, for instance, I'm one that qualifies for a subsidy, maybe I can get a link out to the federally funded exchange and actually qualify for a subsidy. Or maybe I'm over the age of 65 and I actually don't qualify for the exchange, I qualify for Medicare. Well, maybe there's a link out that I can get on a Medicare plan. And those are kind of the two different exchanges that are taking place today.
Okay.
I think also, though, they're going to be responsible for reporting to the government. So the exchange is really in charge of accumulating all the information, determining whether or not you qualify for a subsidy, reporting back to IRS. It's a coordination between HHS, IRS, and of course getting the information from your employer.
So yeah, to go a step further, our understanding of that would be I work for an employer or I don't, and my employer doesn't offer benefits, so I go out to the exchange and I say, here's my information, and basically what it does is it's supposed to look at my last year's reported tax earnings and determine whether I'm qualified for a subsidy or not. And depending again on my income level, to give you an idea, I go out to the exchange and I'm currently making less than $45,000 as an individual or $93,000 as a family. I could qualify for a subsidy through the exchange. If I happen to be making less than 100% of poverty level, then I wouldn't be able to access plans through the exchange because I'd qualify for Medicare, Medicaid, excuse me, thank you. Keeping in mind in Florida, we elected not to expand Medicaid, so Medicaid level for us is at 100%. So 100% of poverty level to 400% of the poverty level. So basically, you're talking about somebody that's making $11,500 a year up to somebody that's making about $45,960 could qualify for a subsidy as an individual.
So it sounds like eligibility, at least one component would be defined as income. Any other eligibility requirements involved? Are there any other eligibility?
There are.
Okay.
So, in essence, if I currently work for an employer and my employer provides benefits that the Affordable Care Act would deem to be affordable and adequate, that may or may not be a future question coming up, so I don't want to spoil the thunder of it. But basically, because my employer offers benefits that are affordable and adequate, I would not qualify for a subsidy through the exchange.
Okay. And then another question pertaining to the exchanges would be, when do people enroll? So what does the timeline look like for that?
That's a great question. So it's so funny because our firm, we're so focused on health insurance. I feel like what I'm talking about, all y'all already are aware of all of it. But the exchange is going to be open October 1st of 2013, and it's going to be open all the way through March 31st of 2014. So the actual exchange is going to be open for a 6-month period of time. Depending on when you enroll in the plan determines when your effective date would be. I can't remember the exact dates, but let's say, for instance, I enroll in the exchange all the way up until December 5th, let's say. Well, then my effective date would be January 1st. But if I enroll in the exchange on January 5th, then my effective date might be February 1st. And it just keeps that timeline going depending on when you actually enroll in the plans.
And also, you know, we'd expected businesses to be able to, small business to be able to use the exchanges, and that's been delayed till next year.
Okay. So if if someone is to go to the exchange and they don't qualify for a subsidy, could their employer contribute to the premium?
You could if you had that would be possible if you had an HRA arrangement or some other arrangement that provided for that type of arrangement. So it's possible now. I don't want to get into HRAs actually because it's a little bit too much for today, but the basic idea is that under an arrangement like that, as an employer, you could arrange to have dollars set aside to reimburse an employee for their insurance premiums as long as you have the adequate documentation. So I think that employers are going to start looking very hard at other arrangements that they may not have in place currently to help employees, with those insurance premiums.
And a couple other things that are working in there is that if any of you have already gotten that exchange notice that's due out October 1st, or if you've issued them out to your employees, you'll notice that there's a paragraph in the front that says if you go out to that exchange and you don't qualify for a subsidy and your employer is providing benefits in general or that are affordable and adequate, your employer may or may not decide to contribute to the plan. A big challenge that a lot of employers have, big or small, is participation. A lot of the carriers are relaxing those participation requirements. And when I say participation, what I mean is if I'm an employer and I have 100 employees that qualify, they're eligible to come on the plan, most carriers ask for 75% of those employees to actually enroll in the plan. If you don't get that percentage of employees to enroll in the plan, normally you can't write the group. So keeping in mind that if an employer is providing benefits that are affordable and adequate and they need your participation on that group plan to maintain, I would think most of the groups that I've actually spoken with, for them to fund you to go out to the exchange might be unlikely. So we'd have to see, and I'm sure there's some employers that might see that as a strategy. I know some of the carriers, as I mentioned, they're relaxing some of those participation requirements, but most of them relax them with this term they call load. And with a load, that means that they increase the premium cost to offset because they might get adverse selection there by the folks that actually come on that plan.
Well, I think you're also going to see a large dichotomy between large employers and small employers because, the small employer under 50 is going to have and let's say that here in our area, many employers are under 10. So you're going to have a much different set of, benefits for that small group in terms of how you're going to structure them than you would if you had a larger group. So I think that in terms of providing for an individual benefit, if you have a very small group, I think that's what people want. That's the choice that employers are, at least in my experience, are asking for. We want to be able to reimburse our employees for their individual health coverage. We want to have it tax deductible. We don't want them to be penalized in any way. Can we do it under this new mandate? Those are the questions that we're getting most often.
Thank you.
A lot of the companies we're talking to, their concern is that the employees aren't going to want the health insurance because they want more in their paycheck. And so they're trying to figure out, how to do I do the, the subsidy so they can do it themselves, or do we just, they have to do it, or do we, pay the fine and have them, so that's all factoring in as well too. So.
Well, that's the point. An individual, if they're not covered, after 2014,
Right.
they will have the penalty
It's like, right.
unless they qualify for an exclusion. So it's very possible that they could qualify for an exclusion, but that's a financial hardship exclusion. There's a religious exclusion and a couple others, but unless you qualify, you're going to have to pay the penalty. So I think again, that's what employers are looking at. Is there a way I can help them to subsidize this or pay that directly, but still get a tax benefit for myself, of course, and that's more win-win. But, you know, so I think that's what everybody's really looking at right now is how can I do this in an affordable way? As a business owner, how can this be affordable?
So 2 questions. One relates back to the penalty that you just discussed and really trying to understand how would a penalty, because that doesn't sound like a very positive word to me, how would that be assessed to an individual? And then the other question is, what would you say the coverage and costs through the exchange, how would that compare to the plans offered by the employer?
I'll let Steve do the coverage. I can talk about the penalty, though. Unless the penalty is going to be phased in, so the first year it's sort of just like anything else that is on a phase-in. It's not terrible the first year. So it's $95 a person the first year. I think it's $285. I have to look at my notes. $285 or 1% of what they call the, it's a modified gross income test. So basically, if you have to file, say you're single, you would have to file an income tax return if you had for the penalty, over $10,000. So if you made $110,000, easy math, minus the 10 times 1%, you'd have a $1,000 penalty or $95. So you're going to pay the greater of. So you could potentially have a $1,000 penalty. Well, then there's another, it impacts with the type of insurance too. It's a silver plan. I'm a little bit off on the types of plans. I'm not an insurance expert, but basically it's going to phase in though. So that's a not too terrible price to pay for not having insurance. But each year for 3 years it phases in. Of course, the penalties get steeper and steeper.
And I think as the second part of that question, I think that's been some of the challenges, that there's not enough of a penalty there to really mandate that. Somebody like myself, most of my life I've been very fortunate. I've been pretty healthy. I've always had insurance because my wife taught me that way. So, but the reality of it is I probably could have gone without it for several years. I occasionally get a cold and that kind of thing. But to answer the question on how the exchange coverage will look or the cost will look compared to outside of the exchange, the first year they're supposed to mirror one another. So if I go to the exchange and I see a plan, it's supposed to mirror the cost of the plans in the premium outside of the exchange. Some of that is yet to see how all that plays out, because in our business what we would think of is because there's not that $95 penalty might not be enough to entice somebody to now have a monthly cost of maybe a couple $100 versus $95 a year. Who would go into the exchange? Folks that, like I used my example earlier, somebody like myself that I haven't been able to get insurance. I got pre-existing conditions with asthma, so I need to be insured, right? Because it's expensive for me not. So that pool of folks that go into the exchange may not necessarily be the healthiest or best pool. So if you were to fast forward 1 year and you look at that same pool, it's all in insurance is all about spreading risk over the greatest number. When they re-rate that pool, I would be shocked if those rates are going to be the same as outside of the exchange, because then they're actually rating on the experience of that particular pool. And I think we'll find that I think most people would say that for the exchanges, it's critical that they get a lot of folks sign up that are young and that are healthy in order to make it really work. But the first year, the rates and the premiums will be the same, except if you qualify for a subsidy. If you qualify for subsidy, and I just brought some numbers here because I think this kind of really illustrates how this would work. So I go out to the exchange. Again, I'm making $45,000 a year. My employer does not provide benefits that are affordable, nor are they adequate. The cost for me on a monthly basis on a subsidized plan would be between $273 to $364 per month. Okay? But if I'm making close to minimum wage, if I'm making at between 100 and 133% of the poverty level, the cost would be about $20 to $25 a month, which some of us would say $20 to $25, gosh, that's not a lot of money. But if you're making $11,500, that's a tremendous amount of money. And matter of fact, I would say that we, like a lot of brokers, we have a large book of business, and I can't think of too many employer groups that I have where the current cost for the employee-only plan is more than $273, and that's a subsidized plan. So that goes to tell you, if that's subsidized, the actual rates in the exchange they're not inexpensive by any stretch of the imagination. But the coverage is, because of the thresholds they set on it, where they have a bronze level, a silver, a gold, and a platinum, that bronze level, it basically says that it's 60% actuarial. So basically, you, the member, are responsible for 40%, the plan pays 60%, which, without knowing the plans that you're currently on, I'd say probably half the room here has a plan that's not that generous. So there are some increases there, which on the downside of that, you might be paying more money out of pocket a month, but the benefit of that, the benefit's actually better, so that might drive down some of the costs that you would normally have with co-pays and deductibles and co-insurance and things.
Okay, so now one of the other things that I hear mentioned a lot is when we determine eligibility, I continue to hear affordable and adequate, affordable and adequate. So what determines if the plan being offered is affordable and adequate? What are those parameters?
Affordable is literally that. It's got to be. There's actually a test. It's 9.5% of your W-2. So if it's more than 9.5% of your W-2, it's considered to be unaffordable. Now, adequate. I'll let you talk about adequate.
And earlier, the numbers that I was giving as the example of the monthly premium, it's scaled. So if I'm at 100% of the poverty level, the cost of the premiums can't cost me any more than 2% of my earnings. But if I'm at the other end of it, I'm at 400%, the cost of the premium can't cost more than 9.5%. So 9.5% of somebody making $45,000 is roughly about $300 a month. As far as adequate, we use this tool that was put out, and basically it's a calculator where we can dump in information. That information might be, deductibles, co-insurance, co-pays, what are the RX, the pharmacy co-pays, and basically it comes back and it lets us know if that is adequate coverage, meaning that does it hit the threshold of 60%. 60% is the number that makes the plan affordable and adequate. And again, to kind of back up a little bit, if you work for an employer, whether they're small 3-person place or 30,000 employees, and they're providing benefits that are affordable and adequate, one, as a large employer, you're not subject to the pay or play penalties. And the other side of that is that you, the employer, are not eligible for a subsidy through the exchange. So those numbers are pretty important.
Pay or play? Can you elaborate on that? Sounds
So-
like a game, but I'm guessing it's
Yeah.
not.
Well, I guess life is just a game. No, I'm kidding. So basically the way it goes is that if you have more than 50 full-time equivalent employees, okay, and I know what Kathy said, and I know in all the chamber meetings that I've been in, there's a bulk of companies out there with 10 employees, but if you have more than 50 full-time equivalent employees, and you say, I'm not going to offer any benefits, right? I'm not going to offer my employees health insurance, and you have one of those employees go out to the exchange and they actually qualify for a subsidy through the exchange, you, the employer, are subject to a penalty, and it's $2,000 times every full-time employee that you have, minus the first 30. Okay, they give you a 30-person grace, regardless of the size that you are. So a company with 50 employees gets a 30-person grace, and a company with 50,000 employees gets a 30-person grace. So that's basically it. So the pay part, or the play part, would be that I say, okay, gosh, that penalty, for some employers, that might be the best thing to do. I got to say that 99% of the employer groups that I work with, and I know from my colleagues, have elected that they're not going to go the route of the penalty. Why? Because they provide benefits that attract and retain talent. And for a lot of them, it would be a tough time for their employees if they didn't offer it anymore. It's just a strategic tool. So anyway, so then I say, all right, gosh, I don't want that penalty of $2,000, but I want to provide benefits. So basically, if I have benefits that I provide that are affordable and adequate, I'm not subject to the penalty because I'm playing. But if I say, you know something, I'm not going to offer benefits, you all are on your own, and then I'm obviously pay or play, and the pay part would be that penalty that I'm referring to. There's another penalty that comes into place, and that's basically that if I offer benefits to my employees and they don't meet adequate or affordability, and then one of my employees, and this is for the large employer that has more than 50 employees, and one of my employees goes out to the exchange and qualifies for a subsidy, then I could be penalized as the employer for $3,000 times each employee that actually goes out to the exchange and gets that subsidy, but that total penalty cannot exceed the penalty of 2,000 times every full-time employee. So as a strategy, an employer might say, you know something, I don't want to take the weight of that full $2,000 penalty times every full-time employee, so I'm just going to get a plan in place here. It's not going to be affordable, nor is it going to be adequate, but at least I can mitigate the amount of people that'll go to the exchange and get a penalty, and that's just a strategy that some employers look at, because they know that a lot of their younger floors, they just won't do it.
Well, and another issue that with full-time employees is, by the definition, it's 30 hours. And so a lot of companies have a hard time because they consider that part-time employee, whereas under the Act, it's considered full-time. So there was an article, I think earlier this week, on Bell's department stores. It includes seasonal employees. So they said we're going to have to really be strict with our seasonal employees. Instead of allowing them to work overtime and paying them for overtime, you know, each week at 30 hours, you know, they'll have to end their shift. So it's something that a lot of companies are having to do, especially companies, like I said earlier, restaurants and retail, where the margins aren't high enough, you know, to be able to offer this to all their employees.
Which a lot of people see that as, if I'm somebody that I work for an employer and I've been working 32 hours and now they're going to have me work less than 30 because they don't want to provide benefits, a lot of people would see it as, gosh, that's not really a good thing for that individual member, but it might be a best thing for that individual, because if they work those reduction of hours and they actually qualify for a subsidy through the exchange, that might be more of a cost break for them. That might be more financially sound than if they actually were to work more than 30 and qualify for your benefits. So I think that could work both ways. We'll see how that plays out.
And sticking with the strategy, I know we've talked both on the individual side as well as on the employer. So back on the employer side, what would happen if the employer does not offer the benefits next year, but rather elects to offer them in 2015 for the sake of avoiding penalties?
So we see that as maybe an issue that's coming down the pike. So for instance, I do have employer groups today that because of the penalty being delayed, they're not making their plans this year or 2014 compliant, right? Because why? There's no penalty in place to motivate some people. Well, because of the fact that their plans aren't currently compliant, and because of the fact that the penalty and the reporting has been delayed, part of healthcare reform, I can go out to the exchange and I can actually qualify for a subsidy to that exchange. And depending on where I'm at on that poverty level, it may or may not cost me $20 or it might cost me $300 a month. But you flip forward the following year, and then all of a sudden, to avoid the penalty, my employer starts offering plans that are affordable and they're adequate. Well, me, the employee, then I lose that subsidy through the exchange. Why? Because my employer provides benefits, and that may or may not cost them more than the subsidy. And as a result of that, we're encouraging a lot of our groups to step forward, do the right thing up front. If you're financially able to do so, it could avoid a lot of backlash on goodwill with your employees down the road.
And I would say also, I mean, this is the planning year for getting all your ducks in a row. So if you're not planning adequately for 2015, you're in trouble. So.
And so Chris, our banking insurance knowledge expert, brought up about the 30-hour, and that's a really good point. A lot of folks hire individuals on, and they say, gosh, I don't know, Steve, if you're going to work 29 hours or maybe you're going to work 40 hours, right? So you're a variable hour employee. Healthcare industries, hospitality industries, and I could just go on and on down the list, and probably retail establishments hire a tremendous amount of folks, and they just don't know whether they're going to be full-time or part-time. So you need to start getting some measures in place to start tracking those employees to determine whether they're going to be benefits eligible or not. Why? Because even though the reporting has been delayed, and maybe they're going to tweak it a little bit, what you have to report, fast forward to 2015, Steve goes out to the exchange and he wants to get a subsidy. They're going to go back to that employer and they're going to ask for information. Is Steve working more than 30 hours? What are your plans? So definitely, as Kathy had alluded to, this is a great opportunity. Get some systems in place, some measurables in place. And I would urge you to work with a payroll provider. If you're doing time and attendance to your payroll provider, I'm sure they could help you track this stuff.
All right. How would you say, or would you say, that the health care reform law might help us better understand more about our health care coverage? I'm trying to end on a very positive question. You notice that?
Yeah. Well, go ahead.
Well, I was going to say, number one, we're all going to know how much it costs our employer. Our employers have to disclose how much it's costing. Plus, there are a lot more, everything's more clear in terms of exactly what you're getting. I'll let you talk about that.
Well, so one of the things that they came out with was that summary of benefits and coverages. So on a regular basis, I meet with my employer groups. We do open enrollment meetings. We make it educational in nature. Prior to that, prior to being a benefits consultant, I worked for some large employers, and I can remember when I'd have somebody like me come out and do the educational piece. I'd go home and my wife would say, all right, well, you know, what exactly did they talk about? And I'd give her a stack of paper and I'd say, honey, I'm sorry, but I can't really remember all that. So what they did is they tried to come out with that summary of benefits and coverages to streamline that, so that way you could say, all right, I'm with Florida Blue or Cigna or whatever, that there's some process there. I think the byproduct of it all, though, is I can't remember ever coming to meetings like this in particular 5 years ago. And now, in the last 5 years, since healthcare reform's come around, I've been to dozens and dozens of these where we're actually getting engaged with the community to let them know that there's an issue here. I mean, I think we can all agree that it's awesome that they're making affordable care accessible to all individuals, right? I want somebody like myself that might not qualify for an individual plan to be able to get insurance so I can properly take care of myself. But on the flip of that, you know, the rising cost of healthcare, I mean, it's not sustainable. And so some of these things, I think by getting everybody educated to help people understand better how to use the plan, like for God's sakes, if you're having chest pain, shortness of breath, an acute emergency, please go to the emergency room, right? They're set up to help you out. On the flip of that, I grew up in an age where it seemed like the emergency room was the point of access to the hospital. I mean, something happened, my mom would take the emergency room. Well, today there's a lot of urgent care centers, there's walk-in clinics, a lot of the carriers have embedded teledoc and some of these other services that can help drive down the cost for you, the member, as well as all of us collectively. And it's just being a better consumer of the plan. I've definitely met with employer groups that say, listen, Steve, even if I give these plans away, my employees won't take it. Why? Because when something goes wrong, they go to the emergency room and get it taken care of. That's a cultural, and maybe by us bringing this to the forefront, everything else going on, all of us walk away a little bit more educated on it all.
All right, well, thank you. That concludes our questions we received ahead of time. And so now we're going to transition into our Q&A, which we've got, as promised, a few minutes for those. So again, just a recap, so we're all on the same page here. If you have a question, please just raise your hand, stand up so we can see you. Share with us your name, the year that you graduated, Leadership Manatee. And please do me a big favor and keep your question very concise, because I'm going to repeat it through the microphone because this is being recorded for METV. Thank you, Charles. And that way we have it for the broadcast. So at this time, I'm going to ask if we have any questions coming from the audience. Yes, sir. Okay, thank you, Bob. So the question, if I heard properly and correctly, was, is there a difference between the state-run exchanges and the federal-run exchanges? Is that correct? Okay. Who would like to take that?
No.
The only difference that I've seen up to this point is that the states that have elected to run a state-based exchange look like they're already up and running, and the states that have elected to do, like Florida, the federal, we're still trying to determine the direction all that's going to go in. That's the only really the difference I've seen between the two.
Okay, thank you. Thank you, Bob. Anyone else have a question?
Yeah,
No?
I think 30 states elected to have the federal exchange. So most states are letting the federal government do it.
All right, thank you, Chris. All right, I saw a couple hands over here. So again, Greg, the question is, the notice that went out, is it really going to impact, or is there any substantial difference between the size of the employer? Is that correct?
And is there an associated penalty for not complying?
And is there an associated penalty for non-compliance? Steve, it's all you.
Thank you for asking me that question, Brian. Basically, there's two different types of exchange notices. One is with plans and one's without plans. And then there's also obviously Spanish versions available. They're at dol.gov, Affordable Care Act. You can drop down a link. Up until like 2 weeks ago, we were under the impression that there was a penalty associated with not complying. And the penalty was basically $100 per day per employee. But 2 weeks ago, the Department of Labor released a fact sheet, and on that fact sheet said that there was no penalty for not complying to that. But yes, it does. We're urging all employer groups, regardless of their size, to go ahead and issue those out prior to October 1st of 2013. And that is supposed to be a requirement for employers regardless of your size. And I think the thing that's interesting is regardless of whether you offer benefits or not. So you could literally have 10 part-time people that work and you rent out surf skis over or kayaks over at the beach, you know, you're required to pass that out.
But I think really the purpose, or one purpose of it, is just to notify people that there is an exchange. And that's, you know, so whether or not you offer insurance, it's important that people know there's an exchange available.
And some of the information that's in that, that form that goes out, on the one that's, if you work for an employer that does offer benefits, on that form, there's certain highlighted boxes on that basically is the same information that's going to be required of you to enroll in the marketplace. So there is some, like if you were to go to the marketplace and look, it's really, those are snapshots of information that would be necessary to enroll.
All right. We have another question here. So the question from Jackie is relative to HSA, health savings accounts, right? And so the question is, what impact will the Affordable Care Act have on HSAs?
Because it can be a tax benefit for individuals to have one.
Right, right. First of all, you'll still be able to keep the account that you have if you have one. But, you know, really, you could have an HSA and not be insured. Well, I don't know. You couldn't do that. I have not thought about that question. That's a really good question.
So if we were fast forward and we're January 1 of 2014 and I go to an insurance carrier and I ask them for a menu of plans that are going to be available, in the small group space, the mandate, which actually mirrors the maximum amount for a high deductible health plan with an HSA, is that the individual deductible will be $2,000, the family deductible will be $4,000, the maximum out of pocket would be $6,350 for the individual and $12,700 for the family. Those two numbers, those max out of pockets, mirror what's currently available as a maximum with a high deductible health savings account. So in every meeting that I've been with every single carrier, health savings accounts are not going away. Matter of fact, I wouldn't be surprised if down the road you'll see more folks participating in that. Why? Because if you're on a health savings account and you have to do the first dollar out of pocket towards whatever service you're getting done, then you're probably going to think twice a little bit about the service you're getting done and maybe even better, be a better consumer of the product. An example I would give is I'm on a plan now, and for major diagnostics, that's like MRI, CAT scan, and PET scan, I'm responsible to hit my deductible. So for that analogy, I'll just say my deductible is $2,000. So I go over to my orthopedic guy, and fortunately he gave me prednisone, which ended up working, which it kind of takes away my story here in the end. But he also prescribed that I get an MRI done, and at that facility, that MRI was $950. Fortunately, I know enough to know in our industry that I can go to Rose Radiology, I can go to a whole slew of other places, and I can shop to find out where am I going to spend the least amount out of pocket for me personally to get the same service done. It doesn't benefit me in any to spend that $900. So as a result of that, I'm a better consumer of the product because of the fact that I know that I need to shop around for some of these services. Where on other plans that are really nice to have, where if I had a $100 copay on that plan, would I have shopped around or would I have gone anywhere else other than where that $900? Probably wouldn't have, but I did. So hopefully that answers your question.
All right, thank you. I see a hand over here. The first part of the question is defining adequate when we talk about affordable and adequate again, and then presuming you're a 25-year-old female, I believe, and you are going to be paying for the benefits, how will those premiums be deducted? Come out of your paycheck, out of an account, et cetera?
So some of y'all might know that there's carriers out there today that offer benefit plans that have very high deductible, $10,000. We would term those as catastrophic plans. So I want to say for young individuals under the age of 30 or 31, I can't remember specifically, through the exchange marketplace, they would be offered a catastrophic plan. Also for folks that are low wage earners that can't afford to spend money to get a qualified plan that would be a bronze, a silver, a gold, platinum, etc. But the adequate coverage part, it's this formula that's used. Everybody can have access to it. If you do it one time, it's pretty simple to do it. It's basically on DOL.gov, Affordable Care Act. You can get this calculator, and in that calculator, you put in information. And what the information is, again, is it's copay for primary care, copay for specialists, what's the cost if I go inpatient or outpatient hospitalization, What is it if I had to get rehabilitative services done, et cetera? And at the end of that, it spits out this number, and the number that you're looking for to the plan to be called adequate is 60%. So in essence, what it means is that as I'm going in to get services and I'm paying all that premium into the carriers, for whatever I get done, the carrier is required for 60% of those costs, and I'm responsible for 40%. And then it I can't say that word anyway, I'm gonna bypass it. So that's the 60% plan. So now if you're on a silver plan, that's 70%. And if you're on a gold plan, that's 80%. And if you're on a bronze plan, that's 90%. And on some of those plans, some of us probably wish we had those benefits today. They're very nice plans. The interesting thing that's gonna happen as a result of all of this is that for any of you that currently have a 5,000, if you work for an employer that has less than 50 employees, we can do a slew of things, but one in particular is we can raise the co-pays, right? We can lower the co-insurance, and we can raise the max out-of-pockets. So when you take and you're squeezing all the way that down to those deductibles and those max out-of-pockets, the common conclusion for most of us is that the rates will go up. So I think it's going to be a challenge, but we have to see moving forward how all of this is going to play out.
And then I guess the second piece of the question was affordability. And again, there are different pieces of that. The definition is, are you paying 9.5% of your W-2? That's the threshold. It's considered unaffordable if you're paying more than that.
But how does it come out? I mean, if I have a choice between
Oh, great
car
question,
payment
yeah.
and health insurance, and I'm 25.
So the big challenge that we had for a while, we meaning all of us, is that I don't have a job, I don't have a bank account, may or may not have ever had a bank account, and frankly I don't even file my taxes, and I go out to the exchange and I qualify for a subsidy. I'm just using an extreme example to get it, and I go out to the exchange and I get a subsidy. What the carrier wants to know is, how are you going to pay for that? If you don't have a bank account, how are we actually going to debit you? So one of the recent things, probably within the last, I'd say, month or two that came out, is the issuing of low-income earners debit cards. So that way you would actually have a prepaid debit card, so that way the carrier can actually loop into that debit card to make sure that they're getting payment. I just literally heard some of this yesterday, so forgive me if I'm not 100% dialed in on the way to articulate it, but the challenge that you run into is, so I have that prepaid debit card, or maybe even getting debits from my bank account, and maybe my bank account has insufficient funds one month, right? So all of a sudden I haven't made my payment for a period of time, but I'm still going out to the doctors. Have you heard of this part? So I'm still going out to the doctors and I'm getting procedures done. Well, the plan will not reimburse when you don't have payment.
Yes.
They're going to terminate you. They can't do it for a period of 3 months. So there's this period of time between 1 month and 3 months that you could actually be going to your physician, getting services performed, and that physician potentially could be on the hook for whatever those costs are.
I have
it's
heard
a problem.
the physician lobby is protesting that because
Bet.
they're the ones who are going to bear the cost, not the insurance providers. And, you know, they don't have the same deep pockets.
And so a lot of times you hear in our business, it's cost shifting. So how does a physician prepare for that unforeseen? They shift costs across the board for everything. So we all end up feeling
But
it.
physicians can't because
that's
they're on
right.
a fee schedule that's fixed. They don't have anywhere to go. They can't raise their prices. Physicians cannot raise their prices. So you know that, Lynn. So it comes out of their paycheck.
Okay, I think we have probably time for a couple more questions. So I see a question right here. Yes, ma'am? Okay, so I'm going to try to summarize. So if someone elects to go to the exchange, even though they do not qualify for a subsidy, to then take advantage of one of the plans offered, would they be able to do that because the plan offered through their employer was not affordable, correct?
Well,
Or the
Right, but-
adequacy was an issue?
but
Okay.
so you would be giving up a benefit whereby the employer paid a premium. You are assessing it's not adequate. If you're a large employer and it wasn't deemed adequate, they wouldn't even get a penalty if you're not receiving a subsidy. But I don't think that it would probably work like that, because literally, why would you pay out of pocket when you can get a benefit? You would probably just want to subsidize that benefit somehow in a different way,
And
like an HSA account or something else.
And to go a step further, so I can understand, so if you work with an employer today and they're taking money out pre-tax, right? It's usually called a Section 125 plan, and what that restricts is that unless you have a qualifying event, once you start the plan year, you're locked in until the next plan year. So what we do is we advise our clients and we write in the plan year or into the Section 125 plan, a qualifying event would be that you get credible coverage through the insurance exchange. An example of that might be, let's say today is your effective date, or October 1's your effective date, and then you're rolling along in that same analogy. I don't know if it'd necessarily work out that way, but to go along with the question that you asked, so October 1, I'm starting my plan year. Obviously, I'm locked in from pre-tax all the way until September 31st of 2014. But what I find out is on January 1, I actually qualify to go in the exchange. It's a better plan, better deal, maybe or may not get a subsidy, and I enroll in that. Well, that would be a qualifying event that I can roll out of my employer's plan. The other thing that's going to happen on our side of it is, again, when I talked about participation, so today, participation, to hit those numbers, we need a certain amount of the group that's eligible, that doesn't have valid waivers to participate in the plan. Today, a valid waiver is Medicare, Medicaid, VA, or other group
CHIPS.
health insurance. Moving forward in January, we just was in a meeting the other day with Florida Blue where they said they're going to start using individual insurance as credible coverage towards a waiver, and so would be the exchange as well. So we'll see how some of that stuff plays out. But
One other thing, if you're itemizing your deductions, you know, health insurance is a valid deduction. If you're not 65 yet, the AGI limit went to 10%, so they're trying to limit that deductibility too. It's just another way to raise taxes.
Okay, and we have time for one last question. Do we have anyone who wants to ask a final question? Or is everybody just going to say, no, I'm not going to ask that final question? No one? Okay, well, I would like to say thank you, first and foremost, to everyone who attended today for maintaining that level of professionalism, staying on target with making sure that today's event was very educational and informative. I hope you felt that it was. There's a lot to be discussed, as evidenced by the vast amount of knowledge and expertise up here by our panel members. I'd like to say thank you to them, Chris, Kathy, Steve. Thank you so much for being here with us today. And of course, I saved for the last Brian Volner, 2012, Blue. All right? Everyone have a great day. Take care.